영어쉐도잉. What exactly is menopause? Here's how to best prepare and manage the symptoms. When we get to menopause, we are incredibly wise. We know so much. We nearly need to placing huge value on that and get past this really updated way of thinking about menopause, which is, the end of fertility, but certainly the start of great period in our lives. It's about looking after yourself, and then often women, when they get to perimenopause or menopause, have spent a lot of time looking after other people. We do have to put the oxygen masks on ourselves before we help anyone else. So anytime we take to look after ourselves is a good thing. Menopause is actually just a single day in your life, and it's a 12 months after your last period. And per menopause period just mean around the time of. So perimenopause is the time leading up to menopause, and the first 12 months after the final period. 51% of all Australians will go through menopause, a natural part of life. But experts say women and gender diverse people still face significant barriers to treatment, including stigma, misinformation, and a lack of GPs who feel confident prescribing medication. I think there is a variety of different levels of skill amongst GPs. Many GPs are really well equipped to deal with menopause, and some are not so confident. I'd like to see improved education of health professionals at undergraduate level and at postgraduate level, and I'd like to see more emphasis on menopause in GP training. Feels like you're burning from the inside. 64 years old Karen struggled with unpleasant symptoms for more than a decade before starting medication. Concerned about a perceived cancer risk, 10 years on, she's still experiencing symptoms. I really have no idea as to what to expect. I thought it would be gone by now. Actually, I thought once your period stopped that might feel some symptoms for a couple of years and then it would stop. But no, not yet. I'm hoping this year might be. For a lot of women, perimenopause symptoms come as a really shock. They don't really know what to expect. So when women start to get things like trouble sleeping at night or those hot flushy, sometimes a little bit of what we call brain fog, you lose that word. It can be really concerning and really distressing for some women. The typical Australian woman reaches menopause at 51. and may experience weight gain, irregular period, joint pain, difficulty sleeping, tiredness, mood swing, and overactive bladder and vaginal dryness. If you're having really mild symptoms, some of these can be managed just through some simple lifestyle changes, like changing up your diet, really addressing what's causing you trouble with your trying to sleep, doing things as simple as reducing that heat in your bedroom at night. To minimize the severity of symptoms, she recommends women exercise regularly, eat lots of leaf green vegetables, quit smoking, cut down on alcohol, and up their calcium intake. For women who have symptoms that both bother them, for example, really severe hot flushes or night sweats, we know that the most effective treatment is menopausal hormone therapy. Menopause hormone therapy, MHT, sometimes is called hormone replacement therapy or HRT, can be really very effective for some women who are struggling with very bothersome symptoms. Not all women can take it. Not all women want to take it, but it's something that can be offered to you. And unfortunately, though, we see some GPs and some women who are really scared of use MHT because they've heard that MHT increases the risk of breast cancer. Now we know that this is a really complex story and that is a very individual risk, but we still have some people who are really afraid to take it when they don't need to be. So for women who are considering using HRT, it's important for them to know what their baseline risk of breast cancer is without HRT. So we developed this online tool to basically help women to work out what their personal risk of breast cancer is. For those not medication, cognitive behavior therapy and dietary tweaks can help manage mild symptoms. Vaginal aspirin can help people experiencing drynesses in area, and there are other non-hormone medication available to help. But asking questions is the most important place to start. I think you need to inform yourself, as most young people do these days. Maybe our generation is a little bit more stoic, and really I think that was maybe my problem. One more. When it gets to menopause, we are incredibly wise. We know so much. We really need to be placing Choose value on that and get past these really outdated ways of thinking about menopause, which is, the end of fertility, but certainly the start of great periods in our life. It's about looking after yourself, and often women, when they get to perimenopause or menopause, have spent a lot of time looking after our people. You do have to put your oxygen mask on yourself before helping anyone else. So anytime we take to look after ourselves is a good time thing. Menopause is actually start single day in your life, and it's 12 months after your last period. And perimenopause purges means around the time of. So perimenopause is the time leading up to menopause, and the first 12 months after the final period. 51% of all Australians will go through menopause, a natural part of life. But experts say women and gender-diverse people still facing significant barriers to treatment, including stigma, misinformation, and lack of GPs who feel confident prescribing medication. I think there's a variety of different levels of skill among GPs. Many GPs are really well equipped to deal with menopause, and some are not so confident. I'd like to see improved education of health professional at undergraduate level and at postgraduate level, and I'd like to see more emphasis on menopause in GP training. Feels like you're burning from the inside. 64 years old Karen struggled with unpleasant symptoms for more than a decade before starting medication, concerned about perceived cancer risk. 10 years on, she is still experiencing symptoms. I really have no idea as what to expect. I think I will be gone by now, actually. I thought once your period stopped that, you might feel something symptoms for a couple of years and this it could stop. No, not yet. I'm hoping this year might be. For a lot of women, perimenopause symptoms come as a really shock. They don't really know what to expect. So when women start to get things like trouble sleeping at night or those hot flushes, sometimes a little bit of what you call brain fog, you lose that worry, can be really concerning and really distressing for some women. The typical Australian woman reaches menopause at 51 and may experience weight gain, irregular period, joint pain, difficulty sleeping, tiredness, mood swing, an overactive bladder, and vaginal drive. If you're having really mild symptoms, some of these can be managed just through some simple lifestyle changes like changing up your diet, really addressing what causes you trouble when you try to sleep, doing things as simple as reducing heat in your bedroom at night. To minimize this various symptom, she recommends women exercise regularly, eat lots of leafy green vegetables, quit smoking, cut down alcohol, and up their calcium intake. For women who have symptoms that bother them, for example, really severe hot flushes or night sweat, we know that most effective treatment is menopause hormone therapy. Menopause hormone therapy, MHT, sometimes is called hormone replacement therapy or HRT, can be really effective for some women who are struggling with very bothersome symptoms. Not all women can take it, not all women want to take it, but it's something that can be offered to you. And unfortunately, though, we see some GPs, some women who are really scared of using MHT because they've heard that MHT increases the risk of breast cancer. Now we know that this is really complex story and that is a very individual risk, but we still have some people who are really afraid to take it when they don't need to be. So for women who are considering using HRT, it's important for them what their baseline risk of breast cancer is without HRT. So we developed this online tool to basically help women to work out what their personal risk of breast cancer is. For those not keen on medication, cognitive behavioral therapy and dietary tweaks can help manage mild symptoms. Vaginal aspirin can help people experiencing dryness in area, but there are other non-hormone medications available to help. But asking questions is the most important place to start. I think you need to inform yourself, as most young people do these days. Maybe our generation is a little bit more historic, and really, I think that was maybe my problem. So I think we have a lot of stigma and really need to shift the way society view menopause because it's too much caught up in really generations, and I think we need to celebrate the fact that when we get to menopause, we are incredibly wise, we know so much, and we've got a third of our life to really live a great life in rather than considering menopause as the end of everything.